within the grants and within the technology that we're talking about, I used to work at the service unit, so I can see the technology being available to the people in the surrounding area. I transferred to a service unit where we're completely remote. Our nearest, the only grocery store we have is Bash's', and then the nearest Walmart is about a good 2.5 hour drive, 3 hours. Now I have people that come to our service unit with these diagnoses, and they don't have places to go. Now I understand telemedicine can come to the chapter house, but you also have to understand that these people that live in remote areas, they're on income limits. They're also technology, what you guys are talking about here. I can use my phone here and have great service. I drive home and try to go out to do a patient visit. I have no service, none whatsoever. So the technology of the internet or whatever it is that you guys use to connect, how are we, or what is it that we're trying to do to get, you know, to those patients way out in the remote area? And if they can't, by all means, they don't have the funding to drive from where they live into the community of Kayenta to get to the chapter house to sit in front of the you know, to sit like this to be telemedicine. What have we done, or what approach? Is there a grant available for them? Do we have technology available for them? I mean, just like how you guys are doing the mammogram bus shuttles that come out, are they doing a shuttle that will pick up the patients that are diagnosed or indeed on this program that will help them? And in the future, as things are expanding, because once there was never service out there, but now there is cell one service. And where it does reach, and I can say personally for myself, in Kayenta, where I do live in government quarters, I do have internet, I do have TV and phone. But when I go home, where I grew up, my home, I don't have any of those services. I run my electricity off generator, I haul my own water, you know what I mean? And I have many neighbors around me that live the same way I do. And out of the neighbors, I do know one person that does have cancer. And their limited income and their means, what is it that we're doing to get these people help that they need? Because the income that they live on, they don't run to the chapter house. And I know for sure they're not doing this telemedicine program. So what are we doing? What avenues have we been taking to try to meet those bridges? I mean, to help people get across to where they need to. Because this was based for the people that is hard to reach anyway. You know, we do have the local community, and the people that do live in the community are able to use it. And then what about the outskirt people that are way out in the remote area? Because the technology is not there, the funding is not there. So is there a grant on their behalf? Is there, I mean, if the technology does reach out there, which I'm hoping in the near future, well, with the way things are expanding, they're on limited income. How are they going to pay for the internet? Is there a grant that will help them pay for that internet to be able to do this resource? I mean, these are just questions that I know that will come up when I take time.
I'd like to hear from other people.
I think those are great questions.
Yeah.
I share your passion for those concerns. Again, I think it's not a technology-only effort, and I'll just add some of the comments to the previous discussion. That there's a lot of local expertise. There are a lot of community health workers. The concept of the patient navigator. We've coined the concept sort of the e-promotora or e-community health worker, where we can bring technologies more locally. A lot of education that needs to be done. And actually, when we started the telemedicine program, one of the biggest barriers, and one of the state legislators picked 8 sites in the state that were to have the charter of 8 sites. There was not any internet. There was not any broadband. There was not any T1, T2, T3 lines to many communities in Arizona. And so the first thing we had to do was get funding to dig and to put down those lines. So there definitely are grants that can help to facilitate the developing and the expansion of networks. So that's something to be looking for. That we can target searches, help facilitate searches. Those would be applied, the folks that would apply for those funds would be the folks that are in the communities. So that would certainly be something, and again, as we work together and to develop many of the sites that are on the network app that you have, it's because we've partnered with them to help them write those grants to get the technology to where they are. And that can be the technology, meaning to get the connection, to lay down the lines, as well as to purchase the equipment that would provide the service. So absolutely, that even though, you know, there has been increased access, you know, to the point of the chapter houses, the work isn't done. There are many areas that do not have access to any internet connectivity. So that's something that can be addressed. And as you also mentioned, the cell phone. There's a lot of work in prevention and actually even in diagnosis. And here you mentioned the iPhone. There are applications for the iPhone that radiographs are transmitted. Now, radiology has very specific requirements for transmission, for diagnosis. However, the application is sufficient to use to make a decision such as pneumonia, no pneumonia, broken bone, not broken. And when we look at our data in teleradiology, those are the two most frequent questions that are the reason for the radiology being sent.
Yeah,
is this pneumonia or is this bone broken?
You just brought up something. It just happened last week up at Winslow. An individual caught pneumonia. One person had insurance and the other one didn't. The one that had insurance was flown out to Banner Gateway Hospital and survived. The person that did not have access died in Winslow. He was the same age as I was, so you know that's exactly what we're talking about right now. You know, if there was an early diagnosis, I'm pretty sure my friend who I've gone to school with wouldn't have passed on. You know, he was just as healthy as I was. But he might have been walking around with pneumonia for a little longer than he should have been, but he didn't know. He just touched on something.
We just, you know, I've got nothing better than arm waving too. I mean, you put your finger right on it. What I would say is that don't underestimate the power of the community. I mean, I think if there's anything that people like I can do is to sort of say this might be a good idea. I mean, I've been in congressmen's offices in Washington with Navajo, and you know, if someone like Tim or me goes in there, they don't take, all I'm doing is bidding for myself, asking for more grant money, so it's a self-saving, I'm an aging white male, who cares? But I'm making this a little of a caricature, but the point is that you, I mean, you would be dynamite. I mean, I think if nobody can put the case better than you, and don't underestimate now, we don't happen to be in the most advanced state in the country necessarily politically, but you know, we should never give up, and don't forget about that there is still a lot of stimulus package money sloshing around out there. I mean, there are, you know, on the series that I pay for, I wish I was your son, on the way up here.